Hello everyone. Welcome to this morning's webinar to find out more about community guidance training and how it can be used. It's great to see so many people join us today. This session is brought to you by Glasgow's Fair Food Partnership in collaboration with Faith and Community Dundee and supported by the Glasgow Centre for Population Health. My name's Faiza Hansraj Jackson. I'm a public health practitioner specialist at the Glasgow Centre for Population Health, and I'm also the coordinator for Glasgow's Cash First project. In today's session, you'll find out more about community guidance training and how it can be used as part of a cash first approach. This will be followed by discussions in smaller groups to find out your thoughts about the training and whether it's something you could see working in your area. We'll then come back to the main session and I'll ask each of the groups to share some highlights of the discussions and you'll have the opportunity to ask questions. Before we start, I just want to let you know today's webinar is being recorded. We will circulate the link to the recording to all participants. You will also be able to access the link on the GCPH website along with other GCPH webinars. If you have any questions for our speakers today, please use the Q&A function only. We will do our best to get your questions answered. We would ask you to use the Q&A function only for questions rather than general comments. Our events team will be using the chat function to post links relevant to the presentations. I am now pleased to introduce you to Ross Middlemas, who is the Cash First Coordinator at Faith and Community Dundee, which is an anti-poverty organisation based in Dundee. Ross's post was funded by Trussell's Pathways to Advice and Cash Scotland project, which was to trial and explore different cash first approaches to look at reducing the need for food banks. Starting in 2023, Ross's role has revolved around the development of the Community Guidance Training Programme, which is a package that aims to deliver cash-first orientated signposting and referral training to community members and frontline staff whilst taking a holistic approach. Ross is going to tell us about the community guidance training. Over to you, Ross.
Hi everyone, good morning. I'm just going to start my presentation and I'm hoping that this goes without a hitch. So thanks again to Faiza for inviting me along today to talk about the community guidance training. And as Faiza said, a big part of our project has been the development of the community guidance training since 2023. And that's been part of a wider strategy around looking at cash first work across Scotland. But particularly in Dundee, we've had, we've developed the community guidance training. We've also done some work with food bank referral agencies around the 3-step referral system. We've also trained frontline services in this approach as well. And we've also been developing a partnership at Ninewells Hospital alongside colleagues in public health and also in the NHS's volunteering programme too. So just to give you an idea of how we got here in the first place, this has been going, this process of developing the community guidance training really goes way back to 2018 during the Menu for Change pilot, which was a partnership between various places like Nourish Scotland and Oxfam, as well as Faith and Community Dundee, and that led to the development of the What Do I Do If leaflet, which has been a signposting resource that is now been taken across Scotland and actually much of the UK. I think 31 out of 32 local authorities across Scotland use these leaflets, but you might find them as worrying in your local authority as worrying about money leaflets, and Independent Food Aid Network have definitely taken it on. But during the development of that leaflet, one of the things they recognised was that there was maybe a bit more training that could be done with community members running alongside that to kind of give them a bit more confidence about the directions they were pointing people to. So one of the things we've developed over this time is a bit of signposting training, a bit more kind of lighter touch stuff that my colleague Danny, who's actually here with me today, was delivering to the Community Food Network and to other places. And the project was also shaped by Dundee Fighting for Fairness, which is our lived experience project based in Dundee that does a lot of work alongside public bodies to try and affect and change policy. The training itself anyone who came to the Cash First conference, the week conference that FISA put together a couple of months ago, will probably be familiar with a lot of this material I'm talking about today. But what we effectively did was create 4 modules within the training, and it really was just to kind of focus on how best to support people who present with not only financial worries and the stresses of that, but also a lot of the things that run alongside that. But also we want to create or have a focus around how to actually have these conversations in the first place, and to give people a bit of confidence around how to engage and those kind of things. But certainly we see quite a lot in communities that people who are presenting with money worries or also have the kind of comorbid issues that run alongside that, like their mental health, substance use, these things as well. And it's really, for a lot of people, it's about moving forward in one area will allow them to move forward in other areas. So it's not just that kind of focus of cash first being cash only. It's sometimes not as easy as that. And it's the recognition that maybe someone needs to look at addressing what's going on with their mental health before they can even think about moving forward with their financial situation. And then the opposite of that can also be true as well. So the training is intentionally light touch, as it says there. It is supposed to be the first stepping stone into the advice world, but we really, really like to reinforce the boundary between advice and guidance. So since 2023, we've had 3 big kind of cohorts of trainees. And this was really about training people up to do this as a dedicated role. And the vast majority, I would say, of those trainees came from the food projects that are based in Dundee through the Community Food Network in Dundee. So we've had 48 trainees from across 14 different projects. And one of the things that we've kind of really realised is that lived experience has been a big factor in people who have come forward for this training. They've either previously visited like a food larder and wanted to come back to help as a volunteer. So they have had that kind of direct experience of what it is to access these projects when they've been in a crisis. But not just with that, also with substance use and mental health experience as well. One of these things that we have also moved on to do as a result of this, beyond the kind of the training of community members, we were approached by a couple of services, not just kind of third sector services, but actually people from the public sector as well. There's been a kind of more of a recognition, I guess, across the city that a more holistic approach is not just needed, it's actually kind of necessary, because people are in a variety of different roles are more and more finding that people are presenting to them with a variety of different issues. And for their sake, it's been a case of, how do we point people in the right direction at the time that they present to us? So you can see there from the first big kind of service to approach us was Dundee City Council from the housing department. And that included like housing officers, tenancy officers, housing support officers, quite a widespread from across the department. But this has led us to kind of into other having discussions with other services and actually training some of their staff and volunteers as well. You can see there's quite a wide variety of places that have approached us to seek out this training. The big one being Dundee Employability Partnership. We did a big project with them earlier this year, and because it is a partnership, there are people from a wide variety of different services. We had mental health services going along. That's staff from mental health services who maybe didn't know so much about money advice. There were people who come from a money advice background but didn't know anything about food, and they didn't know anything about mental health and substance use. So it was quite a good kind of cross pollination, I guess, of different opinions and actually expert advice in the room. So it was quite good in that sense of, being able to share in that kind of peer sense of what's, things that they might not know about. One of the other big projects we've done with the guiders training is a development at Ninewells Hospital, just a kind of recognition that quite often people are in the wards at Ninewells Hospital and will have a variety of different potentially life-changing conditions. And actually, there's been more of a push, I think, nationally for NHS staff to have these conversations with patients and actually to, make sure that when they're coming out of hospital and they're going back home, that they have, they're having their benefits looked at, they're having a number of different avenues explored and that kind of thing. And this project came about mainly because there's an advice centre at Ninewells that run by Public Health Scotland, who kind of acknowledged that it wasn't maybe as used as widely as they would have liked, and that isn't just for patients, it's for staff, it's for visitors to the hospital as well. So one of the things we kind of got together with them to talk about potentially training up volunteers to be on the wards. And this kind of quite naturally led into working alongside the Social Medicine Society at Dundee University, or DUSMS as they're otherwise known, who have a number of medicine students who have been expressed an interest in that kind of social medicine, in the kind of more holistic picture around people's health and what can be done for better well-being. So we've been working alongside them to identify students who might be interested in becoming volunteers at the hospital. And it gets around some of the kind of red tape, I guess, of potentially training people to be on the wards. It's much easier, obviously, if someone's come from a medicine background to get onto the wards through having had all their various kind of bits of training and the relevant kind of vaccinations and these kind of things as well. So we've trained our first pilot cohort of medicine students based in the respiratory ward at Ninewells Hospital, and that work is ongoing, and we're identifying another block of students to take that on as well. I guess one of the things we're going to talk about, we're going to obviously talk about the community guiders training in more depth in the second half of my talk, but just to give you an idea of how this fits with other training that already exists out there. Some of you may be aware of training from Money Counts, which is currently delivered by the Independent Food Aid Network, and obviously the Money Guiders programme, which is administered by the Money and Pension Service, who oversee that. And I think somewhere it kind of sits between the two of these. I think Money Guiders is a more comprehensive deep dive into that money guiding relationship. But it is also slightly less holistic in that it does just kind of solely focus on that. Ours is obviously a bit more involved than just, signposting or short signposting training for frontline workers as well. There's a bit more to do with around the engagement, around how to have these conversations around, the comorbid issues, as we call it as well. And it's really to say that you don't need to be an expert to run this training. We're very, very, I think we don't expect the guiders themselves to be experts. We very much like to reinforce that boundary between guidance and advice, making sure that people aren't stepping over into kind of regulated territory with the information they might be given to people. But also, we don't believe that someone needs to be an expert in mental health, substance use, and money advice and listening skills and all these things to be able to run the training. I would say the biggest kind of time investment in running the training is becoming and kind of gathering knowledge of what resources are available locally. So and becoming knowledgeable around that kind of angle. We do try and keep it very light touch. We do teach, that's not to say we don't touch on very you could say heavy topics, I suppose, of around suicide intervention, these kind of things as well. But it's intended to be very light touch, and we're not expecting anyone to cross over a boundary into an area where they might feel personally out of their depth. And one of the things we've done in the past is to certainly when I started running this training, there were certain parts of the training material I didn't feel quite as confident in. So I bring along, for example, someone from the social prescribing team to help run the mental health section and these kind of things. And it really helps to build up your confidence in being able to run the training. One of the things we're obviously keenly aware of is that Dundee is a very different city from Glasgow. I think, you know, I think one of the benefits of working in a place like Dundee is for a city, it's actually quite small. It's quite easy to do a lot of partnership working. It doesn't really take that long to get from one side of the city to the other. I know that's obviously different in a place the size of Glasgow, but I think there are key transferable kind of principles and values for the training, but a lot of it is open source. It is very much like a case of there are certain things that we would expect if anyone was running this in Glasgow that they could take directly from us and slot in. But it's going to change because it's going to change depending on what resources are available on your doorstep and actually how referral works and how signposting works for these particular services as well. So I guess that's one of the things to consider when we're talking about this training is, how would this work in the south side of Glasgow or how would this work in other parts of Glasgow? But also, I think one of the things we've identified that's really useful is to, compile either your own resource bank or to use an existing one. We certainly have some kind of resource banks in Dundee that we point people towards. But I know there's also a plethora of these things in Glasgow as well, like Alice and a number of other resources as well. We're going to actually talk and do a bit more of a deep dive into what the training actually involves, going through the modules kind of one by one, to give you an idea and scope of what's actually contained within the materials themselves. So as part of the training, we've developed a training handbook, a kind of train the trainers type thing, I suppose you could call it. And through that, we've promoted a number of different principles and values. The values being over and above, treating people with kindness and compassion, promoting kind of open-mindedness and tolerance, maintaining confidentiality and integrity, being informed in being resourceful, keeping your knowledge up to date and these kind of things, keeping your resources up to date as well, and also fundamentally upholding human rights, because a lot of the things we're going to, we actually, a lot of the things that people are struggling to maintain are directly related to their human rights, for safe housing, for food, these things as well. And these are some of the principles that we try to embed in the training too. We must be able to listen effectively and make the time to speak to people about these sensitive subjects, avoiding stigmatization or insensitive language. And you'll see this through when we break down the modules one by one. Almost all of them have a section around tackling stigma, myth busting, these kind of things as well. When people disclose their stories and experiences to us, we treat them as the privilege that it is for someone to disclose that information. And quite often, people may be disclosing this for the first time, and I think it's actually important that we handle that with integrity as well. Being mindful of the boundaries of the community guider role, maintaining that we aren't stepping over into the advice realm, that we are just in a guiding role. But also that of our own respective groups and organisations. We must also take the time to ensure knowledge and resources are up to date, and we're treating everyone with the dignity, respect and support that they need to ensure that there's equity for all. And kind of recognising that equity is, making sure that everyone's coming up to the same level, even if they've started slightly further back than everyone else. So to talk about the first module that we have, it's really broken down into 3 areas, and it's probably in a lot of respects the shortest module, but because there is a practical element to it, there is a bit more of a time investment in that, I suppose. So we talk about the first area being active listening skills, really coming down to that, fundamental level of engagement, and looking at some of these things around body language, open and closed questions, paraphrasing and clarifying, but also with the caveat that this doesn't necessarily work for everyone. I think, neurodiverse people and that kind of thing can interpret these things differently, and actually what looks good for them for neurodiverse people is, slightly different. Also looking at boundaries, asking people to quite often consider what the boundaries are of their own individual projects. That's going to differ from place to place. If it's a food project based in a faith community, that might look very different to another setting in these kind of things as well. We also look to embed the very specific boundaries we have between guidance and advice, and actually maintaining that people aren't crossing over into that they aren't giving out information that is technically regulated by the Financial Conduct Authority, making sure that they're not, maybe offering potentially legally problematic advice to people who have no recourse to public funds, a whole number of things. And also reassuring them that they're not there to fix everything for everyone. I think that's a very important boundary to put in place. And I think when we don't maintain that, it can be very hard to separate life, our personal life from work as well. Also, the last section of this particular module is around confidentiality and looking at what that is, not just people's personal information, but anything that's shared in confidence, how it's handled, but also fundamentally from a care and protection perspective, when it's appropriate to pass that information on to a line manager or to another authority as well. The second module is around mental health, how to engage, and fundamentally self-care as well, because we have to look after ourselves after these potentially difficult conversations. And the first part is really around how to engage. It's looking at, very a kind of light touch approach to psychological first aid and what to do for those who present in acute distress. What are the very simple things that we can do to try and make people feel calm again when they present in these kind of states of crisis. Also looking at suicide intervention as well. Again, we're not expecting people to go over and above what their particular roles are, but it is just like if someone presents and states that they are suicidal, what are the very practical things that you can kind of do? And for that, we've utilised the NHS's Ask Tell Save a Life material in the past, because again, that's kind of material is aimed at everyone, irrespective of who they are or what they work as, and it's very useful for people's personal lives as well. And we also briefly look at safety plans and anything related to suicide intervention as well, if that's something that someone's particularly interested in. Again, like I said earlier, stigma is a big part of the training. And I think particularly when it comes to mental health, we've definitely moved forward as a society in treating that with the dignity and respect that people deserve. But there's still an element of shame that people feel about their diagnoses. And it's actually just looking at what kind of destigmatizing language and practices that we can put in place, very much coming from a person first perspective around that as well. And then we look at signposting resources. One of the first ports of call we do for this is looking at GP surgeries. I don't know what it's like in Glasgow. I think in Dundee, GP surgeries actually do a lot. They don't necessarily advertise particularly well. So there's, in Dundee we have things like listening services. We have, access to social prescribing, the social prescribing service as well. But then also looking beyond that and looking at what are the local resources that are available nearby. Are there crisis centres? Are there wellbeing centres? Are there peer groups? Are there counselling services? All these kind of things as well. And also touching on the national resources, because sometimes these crises strike at a time when a lot of places are closed. And the last thing is really about self-care for that module. It's looking at what we have come to realise has been very, very important, and that's kind of treating vicarious traumatisation. I think coming out of COVID, a lot of the food projects across Dundee had to carry a big burden for quite a long time around supporting people, and also just unfortunately when things don't go well for people, the people in these projects were carrying a lot of weight, and we've tried to incorporate some of that into the training as well, and to actually bring awareness to vicarious trauma, but also looking at what can be done about it, considering our warning signs, and considering what works best for our own well-being. So actually taking the time to look at that as well. The third module is around substance use and stigma. Looking at some, first of all, we look at the substance use disorder, try to do a bit of myth busting around that, and actually look at the reasons for why people use substances. And I say good and bad because quite often people use substances for, what are quote unquote good reasons, around celebrations and cultural influences, these kind of things, but also looking at how trauma, self-medicating poor mental health or chronic pain, and these kind of things too. We also look at the commonly seen substances. I think in Dundee for a number of years we've had, there's been a problem with the use of street Valium, and actually raising people's awareness of that, because I think that the common public perception around substance use is that, that heroin is still the big kind of thing, but actually what's contributing most to overdose in the city has been use of street Valium alongside other things. And actually looking at how this develops, there's a really good video from Khan Academy that we've used in the past to kind of illustrate how that develops, and what's the criteria for someone having a substance use disorder. Again, we look a wee bit at polydrug use and overdose, and looking at how the presence of multiple drugs in someone's system is what drives people into a state of overdose, and how these things interact with our nervous system and those kind of things as well. But also fundamentally looking at kind of spotting the signs of an overdose and what to do. And introducing and discussing naloxone. We don't pressure people into going and getting trained in administering naloxone, but some people I found quite a lot when I've been delivering these trainings didn't actually know what it was, or assumed it was just an injection kit, but didn't know that there is a nasal spray and these kind of things as well. So I'm kind of bringing more awareness to that, and actually how life-saving it is as a drug as well. We also talk about stigma, and how this affects people in recovery and their friends and family, but fundamentally focusing in on the destigmatizing language around substance use. I think people who use substances have been kind of classified as the modern bogeyman in a lot of ways, and it's actually trying to cut through that, and look at treating people as people with problems rather than people who are problems, basically. And finally, looking at the signposts and resources for substance use specifically. So who is it that prescribes things like methadone, and a lot of the medication-assisted treatments? Who are the third sector organisations that support people with substance use and alcohol addiction? Looking at peer recovery groups, who in the area delivers smart recovery groups, who delivers alcoholic or Narcotics Anonymous issues as well, who delivers rehab pathways. Is there a particular service that people need to go to if that's the route that they want to explore for themselves, and also looking at associated issues like homelessness and gambling. I think gambling in particular is one quite often flies under the radar, but is again a big comorbid issue of people with substance use challenges as well. And the last one we touch on is the cash first signposting, referring, and resources module. And first of all, we go into explaining what the cash first approach actually is, how it's part of a national strategy to help end the need for food banks. Also, a lot of the work that's going on in the campaigning side of things around trying to push for an essentials guarantee to operate benefits, payments, low wages, these kind of things as well. But also looking at ways to talk about money, how to ask the question. There's some really good material from the Money Matters training that we pull in for that as well, to help explore that and explain that as well. The second part is around stigma, around kind of myth busting social security fraud in particular. With regards to disability benefits, I think there's still a common media and political kind of angle that seems to push that people are quote unquote at it, but actually that's not represented in a lot of the data that comes from the DWP and Social Security Scotland too. But also fundamentally pushing that poverty is a systemic issue, and attempts to put it on individuals is entirely the wrong way to approach it. The other thing we look at is around dignity in local food projects. So, again, we're highlighting the dignity principles from Nourish Scotland. I think one of the things we want to maintain is that the food banks are amazing, do an amazing job, but they actually don't represent or give people a lot of choice in the food that they access through those projects. And, looking at what alternatives exist, but also discussing the 3-step referral system that we've put in place and have worked alongside food bank referral agencies to talk about. And the last thing is around cash first signposting. So again, highlighting and encouraging the use of the local cash first leaflets in Dundee. We have what I do if, but then there's also worrying about money leaflets in most other Scottish local authorities as well. Also discussing the Scottish Welfare Fund, how that works, what it's for, how to refer, and what are some of the kind of guidelines around accessing that fund as well. And the last thing we do is actually just do a bit more of a deep dive into what the money advice services actually do. In the past, we've had representatives from money advice services come along to actually talk about what they all individually do, and some of the hidden things that are not hidden things, but some of the things that are less popularly known around them, especially when it comes to access and energy support and those kind of things as well. But that's been particularly useful from our point of view in the past when we've had those representatives along, because it's very easy for people to ask questions and to get very, very simple and clear kind of guidance on how to support people. So that's a lot of the training. We normally, if we were doing the 4 modules, we would normally split it into at least 2 sessions. I think each module takes around about 2 hours, and I think doing it all in one day is kind of quite tough on people's retention. I think it's very hard to retain so much information from such a broad kind of range of subjects. So we'd always kind of at least push to do maybe 2 of the modules in one session and then 2 of the modules in another kind of 4-hour session to do that.
Now that we're all back in the main room, could I please ask you all to turn off your cameras and mute yourselves, apart from the facilitators, please? Thank you all so much for participating in the group discussions, and I do hope you had an opportunity to share your perspectives. Facilitators, I'm going to come to you to please share 1 or 2 highlights from your group sessions. If we could start with Ross, who's on top of my screen.
Hello. Hi. We had a really good chat in our breakout rooms. I'm going to be perfectly honest and say that I didn't take loads of notes because I think it was mainly a Q&A. I think one of the things that people did say is there's obviously there's a lot to take in. It's quite a broad and comprehensive bit of training. And you know, I think there's questions around what ongoing support there is and that kind of thing as well. For the community guiders, I think one of the acknowledgements that people have said is, have stated is that they think it's a good idea. It is just an issue of finding the resources and time for someone to take that on, who's going to facilitate that. And I think there's a bit of work we could do around that to support people to do that. But I'll leave that for the Q&A anyway. But also someone else asked, is this something that's already covered in people's existing training in other organisations? I know not everyone here is going to be from a food project. It might be from a wide variety of different services, but is this something that's already covered in your kind of organisation's existing training as well?
That's helpful, Ross. I've taken a few notes from what you've you've said to
I do
me.
have notes. They're just
Okay.
scattered. Yeah.
And I think that's a point, isn't it? It's a good point to have, what are around ongoing support and about, is this already covered in training? Because I guess based on the people that we mainly deal with, the organizations that we work with, there is quite a difference, I think, in what is standard training. So yeah, I think it's a bit of a different strokes for different folks situation here. Danny, could I ask you to go next, please?
Yeah, so the feedback I think in general in our group was positive, and particularly looking at, there is a recognition there can be a gap between, why someone's presenting and actually the knowledge base of volunteers and staff sometimes, just because the environment isn't maybe always prepared for that, within a food bank or within other similar settings. So it's really important that that kind of environment is actually created to enable these discussions to take place. And it's it's actually a really good leveler and a kind of creating a good baseline for volunteers and staff to take a similar approach, look at similar pathways of support for people. And yeah, overall it's a good leveler for that, and also particularly it was highlighted that looking at the issues of stigma and people with addictions, and actually it's just a really good way to raise awareness of that issue in particular, and just how as a whole community a different approach can be taken to support people. But it is also acknowledged that that it is important that what's already happening on the ground is very much part of the training within any locality that it's delivered in, because there already is a lot going on in space in different communities. They're the experts. There's a lot of really good work going on, so it's making sure that is really part of it, and also how it could be adapted to somewhere like Glasgow specifically, where there is a lot of people who are looking for support who have no recourse to public funds, and there's a lot of stigma related to that. So again, I think the idea is that it gives a good framework, and that you can then input the relevant information for your area, and make it really adaptable, and also really highlight and promote and celebrate the work that's actually happening within a locality as well. Timing of the sessions was mentioned, and I think what we'd looked at in Dundee was, and I think Ross already covered this, but in general, we're trying to look at how do we make sure it feels accessible to people, because it's a big commitment. You're covering a lot of topics, but how do you make it work for people when you're trying to do it face to face? Because you could probably get most out of that, and people get most out of that particular way of doing it. So we've just saying, look, you can adapt it to suit what's needed. We used to do 4 sessions, it's now down to 2. And it's just, there's opportunity there to adapt it for what you think the volunteers or staff might need. So overall, I think very positive discussion.
That's really helpful, thank you. Rika, do you have a couple of things you'd like to share from your group?
Yes, in general, people really liked the approach. They thought it was very thorough and very universal, and that it could almost be used as a foundation course for anyone working in social care, especially since it covered, mental health and stigma. What they also liked about it is that it's a good mix of light touch and more in-depth training. One question that did come up is, same as Danny mentioned earlier about, whether it would be adaptable for other areas, especially rural populations. That came up, but in general, lots of really good feedback.
That's really good to hear, and it's nice that you've had some similar but slightly different feedback as well, Rika. That's good. I'm glad all the groups are engaging quite so well. So In my group, yes, there was comments around being positive, lots of good stuff, it's a good idea. There was, however, mention, I will say this is because I had colleagues from food banks and health improvement teams that are already doing some of this work. So there was mention of there being a bit of overlap. And there was also discussion around how, for example, health improvement within Glasgow do deliver sessions to community organisations, and they do bespoke sessions as well. And the thinking was that perhaps they could use some of the content from the community guiders training and use that as part of bespoke sessions. And I think that's a really key thing, is about adapting it for your own use. You don't have to take it as a whole package. You can pull out the bits that work for you. I said if there's ways that they're doing it, there's no need for duplication of effort here. It's just a question of building on whatever's already out there, and if there's bits that are helpful here, to add them in. There also, in terms of problems, engaging with volunteers, getting commitment and buy-in, and volunteers were thought to be the ones who could perhaps benefit the most from this, but that it might be difficult to actually get them to engage. Yeah, but it's nice to have a bit of variety of feedback. So thank you so much, everyone, for doing that. Do we have any questions? Because I'm conscious of the time. If we've got any questions, please pop them in the chat or raise your hand, whatever works. If we don't have any questions, that's okay, because we're trying to finish this webinar on time, so I can always wrap us up. If you have any questions later, you have our details, please get in touch, don't be shy. Hello, Jim. Go ahead.
Hi, thanks. I put a question in the Q&A, but I'm not sure if you've seen it. It's just in terms of the substance abuse part of the delivery. I work for Action on Smoking and Health Scotland, and we're really concerned about the impact of tobacco use on the country generally. And any opportunity to talk about the impact of tobacco use, the cost of tobacco use, and where to get help to quit is really important for us. And I just wondered, when you're talking about substance abuse, do you talk about tobacco use as well? Because smoking prevalence rates for people with substance use disorder are 5 times the national average. And it's an enormous health inequality, as well as being a very expensive habit as well.
Thanks, Jim. That in a word, I've not really talked about that, and I think you're right. I think that is a bit of a gap. I know there's certainly been interest from the local smoking cessation teams in Dundee, who do a lot of work actually around the food projects and do pop-up surgeries and that kind of thing. But I think that is definitely something we should factor into the later training. And to kind of illustrate the point, I guess, that Faiza was getting at, if people want to add stuff to the training, it is very much a kind of open source framework. So if that's more relevant, if certain parts are more relevant than others for your particular setting, I think that's a good thing. But I take your point, Jim. I mean, one of the things we added in was fairly recently was around gambling, and I think that was just because we acknowledged that was an overlooked kind of area. But I think smoking and tobacco use actually is a really good thing that we could add in future sessions as well. So thanks for that.
I'm so sorry to cut this off. I'm just conscious of the time. So I just want to say thank you to everyone for participating in today's webinar, for your comments, for your questions. One of the main aims of our webinars is to provide you with information that will help you in your work, particularly to raise awareness of the different cash first approaches that are being used around Scotland. I'd like to say a huge thank you to Ross as our speaker, our lovely facilitators, and to all of you for attending today. The webinar has been recorded and will be made available after the event. We would really welcome your feedback and thoughts on the webinar, as these help us to develop future webinars. I note that my colleagues have already put a link in the chat to the feedback form, and they'll also be including a link in the follow-up email after today's session. Finally, a very special thank you to the Glasgow Centre for Population Health Communications team for helping us to put the event on today. We hope you enjoy the rest of your day. Thank you so much. Bye, everyone.